So here we're going to show you a technique for the anterior neck. So we're going to be working the platysma. So the platysma is a very broad, flat muscle. Some people actually call it a fascial sleeve, but I think it's actually a muscle. And it comes from the upper neck, the skull, and it goes down across the mandible, and it attaches into the upper ribs, the thorax. And its job is pretty unique. Its job is to pull the cheek down and the fascial skin up in the chest. And actually in horses they use this platysma to shake off flies. So it was give us this crinkling in the neck. So the platysma. We work the platysma, or I work the platysma first if I'm working SCM, scalenes, or even like the deep cervical neck flexors. If I'm coming in and doing this real intricate network here, I'll generally start with the platysma just to get a bit of blood flow, just to increase the movement, and just to get my client accustomed to being worked in the anterior neck. Not a lot of our clients have anterior neck work performed on them, so the platysma is a very, well, it's not easy, but it's very easy once you understand the technique of working the anterior neck. So like I said, the platysma comes off the jawline and it goes onto the neck. So it's a pretty broad muscle. So we want to work it in different chunks depending on the size of your hand and the client's neck. So we start Kiki in neutral, and what I'll do is just have her look away. So this exposes the platysma. Come back, she looks away, this exposes the platysma. So what I'm going to do with a very soft hand, I contact, this is the SCM here guys, I contact the inside, the anterior part of the SCM. With a very soft hand, I make contact, take up a little bit of fascial tension, so I'm tensioning the platysma muscle, and she looks away. And as she looks away, she creates the motion. This hand doesn't really move until about now, when I'll scoop around and come onto the laminar groove. And I'll come over like this, and I'll repeat. So I make contact first, she looks away, and I follow her around. I'm going to show you with the other hand. Invariably I don't do it this way, but for camera purposes you'll see. See, my hand is very soft and it doesn't move. She moves around me. The key thing we see with people doing this incorrectly is they're applying too much pressure. So just relax, Kiki. I'm going to apply pressure down. That is not nice. That's jujitsu. So the pressure is not down, guys. It's more like I'm trying to pull away and around. So here. So my pressure is coming backwards. Look away. So I'm trying to hook that muscle and move around. So here we're working the upper bands of the tissue. Now I want to work the lower bands. So I use now my index knuckle and her collarbone as my reference. So I'm here, soft hand, take a deep breath in, look away. So you think I'm going over SCM here, anterior medial scalenes. I might even get a bit of levator as I get around here. But my intention is platysma. And what you'll find sometimes when you're working the platysma, you'll see like a shimmering or a shaking like this, normally in here. That's called a local twitch response in neuromuscular therapy. And that's normally a telltale sign of either trigger points in the SCM, in the platysma, and or the scalenes. And I know this is not a skin rolling video, but skin rolling is very, very powerful here, guys. We taught you skin rolling probably month 1, I believe, second or third video. You can really foam roll. You can foam roll the neck, but you can really skin roll the neck here. Last one. So now I'm going to do it I'm going to use my index knuckle as my guide. She looks away. I just follow around. We can add in motion. So I'm here, And I don't want to block the camera, but I can depress her shoulder. Because remember, the platysma elevates the thoracic. You okay? She's making all sorts of noises. So we want to open up this space, anterior neck. So imagine in a session, I've just done the platysma work. Kiko already looks a bit more comfortable looking this way. This is going to give me access to the scalings, which we'll be showing you in the next 5 or 6 videos. We can come in here, posterior neck. We can come in and do the vagus scapula. So by opening up this area of the neck, just opens up this whole upper quarter, this area here, which is hugely important, hugely. So platysma, great technique, and it's a technique I use a lot actually. So just to recap, the real key thing is, it's never a fist. There's never a closed fist anyway. It's open fist and I'm very floppy. And I'm moving around. I've never had a client complain about this technique yet. But you don't want to have any tension here. If you have tension here, the client can feel that. So it's a very soft hand moving around. So platysma, especially people having craniofacial TMJ issues with the SCM and the scalings, any issue on the jawline, platysma is definitely